This segment of Showcase is brought to you by Secours, and you might have heard about AFib, but if you're like me, don't really know what it is. Dr. Bowie is our expert here. Dr. Bowie, what is AFib?
Yeah, atrial fibrillation is the most common abnormal heart rhythm in the general population. The way I think about it is if you live long enough, you can get atrial fibrillation. What it is normally your heart contracts synchronously with the top and the bottom chamber. When you go into AFib, it's a problem of the top chamber that causes it to quiver and beat irregularly and causes the bottom chamber to fire rapidly, inefficient, and can cause a variety of symptoms.
Wow. Is that something that we always know is happening? Like, do we feel that physically, or are there people who actually have AFib and are not even aware that it's happening?
Yeah, very good question. So most of the time people will feel symptoms like palpitations, chest pain, shortness of breath, dizziness, and lightheadedness. There are a subset of patients that will feel very vague symptoms like fatigue or decreased exercise tolerance or even no symptoms at all.
Wow. How do we know if it's time to actually come in and get checked out?
I would recommend just getting the guidance of your primary care doctor or general cardiology if that's
Great way to go. Get someone else's advice. Don't just show up and go, hey, I've got this. You actually do need to have someone tell you correctly.
You should be able to get a diagnosis, and with the advent of all these new technologies such as smartwatches as well as cardiomobile, we are getting earlier diagnosis, which usually leads to better outcomes.
Now, you are kind of a part of the biggest groundbreaking area because Secours was one of the first to have some of this cutting edge technology to be able to help with this. Tell us about that.
Yeah, so we were actually the first to introduce pulse field ablation, which is the newest technology to treat AFib, non-thermal base, first to perform it in the Commonwealth of Virginia. And then really exciting, more recently we introduced the most advanced technology within this ablation system, which is the Medtronic Affera system with the Sphere 9, which brings in this one catheter high density mapping capability with dual energy, including PFA, which is pulse field ablation, as well as radio frequency, that really allows us to tailor the treatment to the specific needs of patients.
Wow. So what does that look like for our heart then, if that's something that we're having done here? Because it sounds pretty cutting edge with all the technology.
Well, and realistically, we can simplify it. AFib comes from this chamber called the left atrium, and the classic triggers or starters of atrial fibrillations comes from these pulmonary veins that you can see here. And they typically fires and initiate triggers that can be treated through medicine indirectly, but when we do catheter-based ablation, we bring in the catheters and create this electrical fence around the veins through a process called pulmonary vein isolation. And this is the mainstay, gold standard for treating atrial fibrillation, to remove the triggers of AFib, allowing patients to come off of medicine, decreasing the risk of stroke, heart failure, and improving quality of life.
And what is the aftercare like for that? What kind of recovery process?
So with all of these newer technologies, the advantages now is the procedure time is less. Patients have less exposure to anesthesia. They're typically discharged on the same day.
Oh, wow.
And a lot of times, these procedures can be performed with minimal to no radiation exposure, and overall just really getting patients back to their daily lives.
That's incredible how far this has come, because I'm sure just even in the last few years that has changed so much. This has been really wild to learn about. Thank you for teaching us today. And if you need help, if you want to find out more about that, Dr. Bowie and all the incredible professionals are right here at Secours, and you can learn more. This was so wild to learn about today. Thank you so much, Dr. Bowie. We appreciate it. And again, Secours can help you with all of your medical needs, including if you want to find out more about your heart care. This segment of Showcase was brought to you by Secours.